Hello, good evening, friends. I am Dr. C.S. Mitra. My qualification is MBBS MD in internal medicine, and today will be discussing about chronic kidney disease and its association with pedal edema, along with the causes and symptoms and treatment. So, edema will be our focus of discussion, and how it happens in chronic kidney disease, what is the mechanism, how to treat it, and then how to evaluate it. So we'll discuss about these things. So let us discuss about what are the function of the normal kidney. Before that, what is chronic kidney disease? Today we'll be discussing about chronic kidney disease. So what is chronic kidney disease? Chronic kidney disease is chronic, irreversible, and gradual progressive deterioration and decline of kidney function. There are three adjectives. Chronic means gradual, progressive, and irreversible deterioration of kidney function. So each word has got its meaning. It has to be slow process. So slowly over period. Like example, I'll give diabetes or high blood pressure, hypertension. So there occurs gradual and progressive deterioration of kidney function. So it has to be gradual, progressive. It goes on increasing day by day, and irreversible. Whatever damage has occurred, it remains there permanently. It cannot come back. It is not reversible. It is irreversible. So these three adjectives has to be there. Chronic is gradual, progressive, and irreversible loss or deterioration of kidney function. It's called chronic kidney disease. Because there is another situation, just for explanation purpose, I am telling that there is something called acute kidney failure or acute AKD, AKI, acute kidney injury. So what happens? There is sudden deterioration. Gradual opposite to gradual is sudden. So there is sudden deterioration or decline of kidney function. There is sudden, and it is theoretically, potentially, it is reversible, and it is not progressive. So what happens? Example is malaria. Just like let us say in malaria or dengue or diarrhea, cholera, these are the conditions where also there occurs kidney failure. But this kidney failure is of different nature. That is called acute kidney injury, acute kidney failure. So there, what happens? It is reversible. Once the malaria is treated, you treat malaria. So kidney reverses in 2 to 3 weeks time, 4 weeks time, maximum 4 weeks time. Usually 2 to 3 weeks time is the time. So during this period, the kidney function during this period kidney functions deteriorates. But after the primary cause, the primary disease like malaria or the dengue fever or the cholera is treated, so kidney function improves. So this is reversible. So there are two types of kidney failure. That means reversible, and the other is irreversible and gradual and progressive. So today's topic about discussion is chronic kidney disease. That means gradual, progressive, and irreversible kidney disease. And this is the definition of kidney disease, and we discuss about other types of kidney failure also. So let us discuss about the functions of the kidney. What happens in kidney failure? So before knowing what happens in kidney failure, we'll have to know what is the normal function of the kidney. In a normal healthy person, what functions it does. We do not know silently, or there are two kidneys, they are silently functioning, and they are performing functions. So what are the functions it is performing? If we know, then what happens when kidney is not functioning, we can derive the nature of the problem. So what are the functions of the kidney? So kidney has got 5 important functions. There are so many functions, but there are 5 important functions kidneys are performing. And number 1 is fluid balance. How much our body needs fluid? Suppose our body needs this much of 1 liter or 2 liters of fluid or 2.5 liters of fluid in a day. Suppose 2.5 liters in a day our body needs. But by some means there is excess fluid intake. Somebody has taken 5 liters of fluid. So what will happen? This extra 2.5 liters kidney will throw away in form of urine. Extra urine will be there. So the excess water will be discarded from the body in form of urine. On the contrary, suppose the opposite. Suppose there is out of 2.5 liters, somebody has taken only 2 liters. So there is deficit. 500 ml there is deficit. So the body will try to conserve water, and there will be less urine formation. So body will try to manage with less of urine. So the urine formation will decline. So the fluid management function is this adjustment. There is a sensor mechanism is there in the kidney. So it detects that yes, there is whatever is our requirement, there is oversupply of water. So let us discard it, throw it in form of urine. Excess by making excess of urine. That is called excess urine. That happens in that healthy person. But when the kidneys are damaged, so there will be fluid retention. Similarly, salt. Our body daily requirement of salt is about 5 grams per day. Our diet, what we take, normal healthy person, so we take diet, it is more than 10, 12, 15 grams of salt. So what happens? Body doesn't retain this extra salt. It will retain only 5 grams of salt. And why 5 grams? Because 5 grams salt we lose daily. So anything more than 5 grams if we take, suppose 12 grams somebody has taken in a day. So the extra 7 gram kidneys will throw away through urine. Through urine, 7 grams of salt will be discarded from the urine. So excess water will be discarded, excess salt will be discarded. So the salt management, salt and potassium, sodium, this management is also done by kidney. Kidney does this function. So we have discussed about fluid management, we have discussed about salt, sodium and potassium management. And another function is excretory function. That means it excretes excess of our body is just like so many factories are there in our body, so many systems, so many organs are there. Continuously some waste products are generated in our body. There has to be some disposal system. So whatever waste is generated in our body, so that has to be discarded. That is done by kidney. So waste disposal, water soluble waste disposal is like urea, creatinine, uric acid. There are so many phosphates. So these are the various types of waste which are discarded from our body. Nitrogenous waste, they are discarded from our body through the kidney in form of urine. So 3 functions we have known till now. The another function is calcium and phosphate metabolism. How much calcium and phosphate are at the level, maintaining optimum level of calcium and phosphate. It is also done by kidney. Kidneys they manufacture, they synthesize one type of vitamin. So kidneys also form vitamin D. Vitamin D3 is there. Vitamin D, it has got 3 forms: vitamin D1, D2, D3. So it will be vitamin dysfunction, calcium and phosphate. And then last is blood formation, erythropoietin. That is also another function. So today we will be discussing about edema. What is this edema then? In kidney failure, what happens? Suppose excess water and salt, it gets retained in our body. So when kidneys have failed because of chronic kidney disease, CKD we call, so there is retention of excess. Somebody has taken excess water, 3 liters or 4 liters of water, but that much of or excess 10 grams of salt. This extra salt and water, it will remain in our body. It cannot cook. Kidneys cannot discard this extra salt because the main discarding machine is damaged. So the kidneys are damaged. So there will be retention of salt and water. This extra salt and water which is retained, that will give rise to edema. So this is called edema. It will remain, that will cause edema, and this edema will be seen in various parts of the body, like in the face, eyelids, it will be seen. Face will be, puffiness will be there. In the lungs, even in the lungs also, fluid will accumulate, and we call it pulmonary edema. When fluid accumulates in the lungs, we call it pulmonary edema. Similarly, there occurs edema in the leg also. We call it pedal edema. When around the ankle joint and feet, we see that the feet is swollen. So we call it pedal edema. So this edema can occur in the abdomen also. There occurs fluid accumulation. We call it ascites. So the fluid accumulation will take place in various parts of the body, starting from face, eyelids, around the eyelids, then in the lungs, in the abdomen. Yes, another condition is nephrotic syndrome. Nephrotic syndrome also, there occurs loss of albumin in the urine. Normally in healthy persons, there is no loss of albumin. Albumin are not filtered in the kidney. They remain back in the body circulation. It is only waste materials which are discarded in the urine, normal healthy persons. But when the kidney is damaged, when the filter is damaged, so the useful good things are lost in the urine. So the most useful thing which is lost in the urine is in nephrotic syndrome is albumin. As a result, there is massive albuminuria. That means the lot of excess amount of albumin or proteins are lost in the urine. So as a result, urine appears frothy. There will be foam formation in the urine. In the come out, the patient will say that the urine is forming foam, just like egg white. When you beat the egg white, it becomes foam-like thing. Something like that while passing urine, you will see. So there will be edema because of the loss of albumin. There is a fall of blood volume. As a result, body will retain salt and water, and which will manifest in form of edema. Again, in nephrotic syndrome, because of loss of albumin, loss of protein, there will be edema. There will be swelling of the body, swelling of the face, eyelid, and pedal edema in the abdomen also. There will be ascites in the chest also. There will be fluid accumulation. So we get edema in these two conditions in kidney-related problems. One is chronic kidney disease, where kidneys are permanently damaged. Even acute kidney injury also there occurs edema. So in both type of kidney damage, kidney failure, there occurs edema. Both the conditions, diuretics are required to be treated, and also in nephrotic syndrome there is edema also. So what is the how to treat the edema? How to treat the edema? So while treating, our objective is to treat the swelling. We will have to treat it. But before treating the edema, the cause of edema has to be found out, and the cause has to be treated. Suppose it is because of the diabetes, or because of the high blood pressure, or because of some other condition like malaria, something. The primary cause should be treated, and then we come to the treatment of edema. So while treatment of edema, we'll have to non-medical treatment like fluid restriction. So in chronic kidney disease, you give that much of fluid what is required for our body. So our body, suppose our body requires 2 liters of fluid or 1.5 liters of fluid, because that much of urine or the fluid loss has taken place. So fluid management should be meticulously done. So how much fluid one has to take, that has to be calculated. A doctor will calculate, and then whatever is the last 24 hours urine output, you add 500 ml, and all the fluid loss, whatever is the fluid loss in last 24 hours, add 500 ml to that. That is the fluid intake for the next 24 hours. So that is how fluid management we calculate. And if it becomes 2 liters, then yes, give exactly 2 liters of fluid. If you give 3 liters or 4 liters of fluid, there will be fluid accumulation, fluid retention, and that will cause edema. And that edema has to be again treated by medications, which will, to remove that edema, excess water, we'll have to give medications. Similarly, salt intake also. Salt, our requirement was 3 to 5 gram is our requirement. We give that much only. We tell the patient to take this much of salt only. If they take more than 5 gram of salt, that extra salt will get accumulated in the body, and this will again cause edema. So edema is a consequence of excess and salt and water retention in the body. Different parts of the body it will manifest. So there will be swelling and puffiness in the face, as we discussed, and below the skin also there will be edema. So what is the treatment of edema? So first we reduce salt intake, then use of diuretics. Restrict salt intake and water intake, and then use of diuretic. This is most important treatment. Despite all these measures, it doesn't subside. The edema doesn't subside because patients may not cooperate with this type of treatment. So there are drugs which causes that with the drugs the excess salt can be removed from the body, and like diuretics like torsemide, these are typical diuretic, or furosemide. These are the drugs which can be given and which will cause a sodium loss and water loss through the kidney. So as a result, there is more of urine formation. So diuretics are the drugs which are given for treatment of edema. In addition to treatment of the primary cause of the disease of kidney failure, the most important treatment is fluid management has to be done meticulously, and excess fluid, whatever fluid or salt it has come. So to remove that excess salt and fluid, we'll have to give medications like torsemide. Injectable torsemide also can be given. And in the lungs also, if it accumulates, injectable torsemide or furosemide, these are given. And one has to monitor while giving the torsemide, 1 or 2 or furosemide, diuretics, we call them diuretic class of drugs called diuretics. So while giving them, one has to monitor, because there is a condition, initially there is a overhydration, body is bloated up, edematous. And while getting treatment, it will subside, gradually subside. There will be euvolumia. That means the normal volume is maintained. So you stay there. Don't go further. Reduce the dose of diuretics. Because if you go on giving diuretics continuously, then there will be a condition will come. There will be dehydration. So more of fluid loss will, salted fluid loss will take place. So that there will be dehydration. So that also we don't want. We want that this ideal, whatever is excess fluid, that has to be removed, and after that time you reduce the dose of diuretics. And body positioning also. Suppose there is accumulation of fluid in the lungs, there is, because if you lie down, patient there will be breathing difficulty. So little proper position should be there so that patient can comfortably breathe. Proper position, 30 degree or 45 degree, elevate the bed end, or the foot end also you can elevate. So that is called positioning, proper positioning. And maybe compression, there are compressors are used, but that is for localized edema, like other conditions where the localized small area is there. So that for localized condition, compressors can be used. And controlling diseases like blood pressure, there is hypertension, high blood pressure, or diabetes, or some other condition. These conditions one has to find out why kidneys are damaged. Who is the primary main culprit which has damaged the kidney? To simultaneously treat these diseases. Because if you treat the disease, treat the primary disease like hypertension or diabetes, early stages, further damage can be prevented, can be protected. The kidneys can be protected from further damage. Suppose you have detected the patient in stage 3 or stage 4, or stage 2 you have detected. So if you give effective treatment, the disease will not progress from 2 to 3, 3 to 4, 5 like that. It will remain there only. That we call it stable CKD. That means by effective treatment, the kidney function will remain there. It will stay there for decades, several decades. It will remain there. It will not progress further, so that further deterioration, degeneration will not take place, because the primary disease we have controlled. So always try to find out the primary disease and treat the primary condition, and treat it, and along with that treat the edema also. And early detection of the disease and this salt intake, salt restriction, fluid restriction, and food also select the type of food which doesn't contain excess amount of salt or potassium. These things are part of the treatment. So if you follow these regimens, patient definitely will have improvement. And this is how we treat limiting the salt intake. This is how we treat. So basically 3 things are restricted: salt restriction, water restriction, protein restrictions. So these are the 3 things to be restricted. Protein restriction is 1 gram per kg of body weight. Normally we give, but in kidney failure we give 0.6 gram per kg of body weight. So these are the measures, restrictive measures, 3 restrictions: salt, water, and protein. These 3 restrictions are done in chronic kidney disease. But the main cause of edema is salt and water retention. So restrict salt and water intake, and excess salt and water which has come by mistake, you can eliminate it through diuretics like torsemide and furosemide. These are the common diuretics.